Oftentimes in children, it's because they can't tell us what's going on, or because their bodies are still growing and developing. You can't treat just an isolated problem, and you need many physicians involved. One of the benefits of floating in hospital is all the specialists have a very close relationship with each other. It's not, it's small enough that they get to work together frequently. They work together in rounding with the residents and teaching the residents, and they work together with their patients. It's not a factory. It's not, they're not seeing thousands and thousands of patients a day, so that they can take that time to really form a unique relationship with every patient. And again, they look at the whole patient, and they can work closely with their colleagues in other specialties if needed. We've had another case recently where a girl was referred in for a GI issue. GI evaluated the girl, could not, identify the issue, and passed the child on to hematology, ended up in pulmonology, infectious disease, and so they definitely work together very easily. The quality of care at Floating Hospital is definitely a step above all the other Boston hospitals in the fact that it's very personal, very family-oriented, and very cutting edge. The nurses at Floating are superior. You don't find nurses like that anywhere else. Some of them have been there 20, 30, even 40 years taking care of these patients, and they really know how to take care of kids, what they need, and how to take care of the families and take care of the parents, because oftentimes they might need more care than the child who's the patient. That's the special thing about pediatrics, is it's not just your patient. You have to treat the whole family, and the parents are your patients and the siblings are patients, so they all stay involved with that. So that's a theme that runs through all the departments in that hospital, and that they approach, not just the child, but the family. Anytime that your child needs to see a specialist, it's very scary, and any parent would say they would much rather themselves have to see a specialist than bring their child to the specialist. So whether it seems like a very small routine problem to us or something that's more serious, it's always serious to the parent. So it is important for them to know that it's someone that I know, that I trust, that I would bring my kids to. Oftentimes I'll tell them that if my child had this issue, this is who I would go to. And that usually is reassuring to them.